Hello everyone. In this video, we will be discussing on documentation. Myself Anusha Anand, working as a tutor in M College of Nursing. Objectives. At the end of this session, we will be able to define documentation, purposes of recording and reporting, characteristics of good recording and reporting, types of records, types of reports, and key messages. Introduction. Nursing documentation is a vital component of safe, ethical, and effective nursing practice, regardless of the context of practice or whether the documentation is paper-based or electronic. This documentation is intended to provide registered nurses with guidelines for professional accountability in documentation and to describe the expectant for nursing documentation in all practice settings, regardless of the methods or storage of that documentation. The main aim of the document is to assist the registered nurse to meet their standards of practice related to documentation. Definition. Documentation. Documentation is the permanent recording of information properly identified as to time, place, circumstance, and attribution. Documentation is the written legal record of all pertinent interaction with the client, assessing, diagnosing, planning, implementing, and evaluating. Recording. A record is a permanent written communication that documents information relevant to a client's healthcare management. Example, a client chart is a continuing account of client's healthcare status and need. Reporting. It is oral, written, or computer-based communication intended to convey information. Purposes. There are various purposes of recording and reporting: decision-making, communication, reimbursement, legal accountability, assessment, planning, research, audit, quality assurance, vital statistics, diagnostic and therapeutic orders, accrediting, and licensing. Let's see one by one. Decision making. Records play an important role for making decisions. Based upon the previous data, future planning decisions can be made. Communications. Records are tools of communication among the members of the health team to promote continuity of care among departments throughout 24 hours of care and during the entire hospital stay. Reimbursement. After viewing the client record, the reimbursement from the medical agency may be done for client care. Cost awareness has increased the emphasis on what care is necessary and no care is to be implemented. Legal accountability. The client record is a legal documentation and it is usually administrable in a court as an evidence, especially in medico-legal cases. The record safeguards the client, nurses, doctors, and the hospital. The record should document client at risk and safety measures implemented. Assessment. Nurse and other healthcare members gather assessment data from the client record by studying client's history and initial assessment and comparing this data with additional subjective and objective information that has been obtained. Current health status and progress towards goal can be determined. Planning. The nurse uses baseline and ongoing data to plan nursing care. Research. Record serves as a reference material for research work. Nursing research results in new approaches to client care and it increases professional knowledge. Quality assurance. As part of quality assurance, program healthcare agencies periodically conduct chart audits to determine whether or not the care provided meet the established standards of client care and financial information about which service generates revenue, etc. Audit. An audit is a review of records. Auditor needs records for doing auditing. Vital statistics. Records are used especially for assessing mortality and morbidity rate. Diagnostic and therapeutic orders. Nurses are responsible for ensuring diagnostic and therapeutic orders that are entered in the client record and implemented. Accrediting and licensing. Record keeping is basis of good patient care, thus it should be integral to all practice. Characteristics of good recording and reporting. Accuracy. Information should be correct to prevent serious mistakes. Use of correct spelling and the institution accepted abbreviations and symbols ensure accurate interpretation of information. It should be always complete with accurate signature. Do not use nicknames. Conciseness. Use a few words as possible to give the necessary information. Thoroughness. Even a concise word, thought, or report must contain complete information. Up to date. Recording should be done on time. A definite time and routine for the reporting make more time and routine for the reporting makes more efficient management. Delay in recording can result in serious omission and delay the work. Organization. Communicate all the information in a logical format to order. Confidentiality. The information should be confidential. Objectivity. Presentation of facts, not personal feeling, to give true picture. Types of records. There are various records which we are using in hospital. Ward records, nurses records, education records, administrative records. Let's see one by one. Patient's clinical record. It includes outpatient records and inpatient records. In most of the hospitals, the inpatient record will be the continuation of the outpatient record. It will be filled up in the outpatient department. This will contain the biodata of the client, diagnosis, investigation, results, treatment, and so on. Doctor's order sheet. Doctor's order regarding treatment, medication, investigation, diet may be written or on separate sheets. Reports on laboratory examination. Normal values include in this for evaluating abnormalities. Diet sheet. It includes types of diet depending on the patient diagnosis. Example for diabetic patient, sugar-free diet. Consent form for operations and anesthesia. Before going to do any treatment or surgery, consent to be taken from the patient or any responsible person from the patient side. Intake and output chart. Intake of the patient includes IV fluids, oral fluids, rice tube feeding, gastrostomy, tube feeding. IV chart maintained in clients with critical illness, diarrhea, diuretics after surgery. Reports of physiotherapy, occupational therapy. Cardex. It is recording of clients' data after organizing, making information quickly accessible to all health personnel. Instruction book. The doctors gave special instant instruction when any incident happens suddenly during rounds. Example, if the patient gets acute abdominal pain, doctor instructs to post the client immediately for appendectomy. Admission and discharge record. Record the name, age, sex, address of the client, date and time of the admission, diagnosis of the client. It gives the record of total number of admissions per day. When the patient is discharged, the date and time of discharge is entered. Census record. It includes the total number of admission, discharges, transferring, transfer out, absconding, and death of the client. Call book. It includes the name of the doctor, date, time, and purpose of the call in emergency situations. Complaint book. It consists of any repair in the ward like machinery, electricity, and water supply. Movement register. It gives the information regarding the availability of doctor and nurses concerned. Example, place where they are available at that particular time. Indent book. The total number of linen, medicines, IV fluids, cotton, gauze is indented for the patient care. The drugs maintenance register. The prescription and supply of drugs generated a variety of records, including pharmacy stock, ordering, dispensing records, requests for drugs from stores, drug administration record, etc. Nurses records. The office of the chief nurse will generate records of the type found in the office with an executive or administrative function. correspondence reports, minutes of meeting. Educational records. The officers, boards and committees of medical and nursing school will produce their own records, minutes, correspondence reports and so on. Types of reports. The reports used in hospital setting usually are change of shift reports, transfer reports, incident report and telephone report. Change of shift reports. This type of reporting most commonly using at the end of each shift, nurses report information about their assigned clients to the nurses working on the next shift. Transfer reports. The patients are often transferred from one unit to another to receive different levels of care and treatment. For example, client transfer from an ICU or critical care units to general nursing units when the client's stable or no longer require such intense monitoring. Incident report. An incident is any event that is not consistent with the routine operation of healthcare unit. Incidents are commonly occur when patient under care within hospital setting. For example, falling from bed or in toilet, needle stick injuries, burns, etc. Telephone report. Nurses inform physician or other healthcare team members regarding changes in patient condition during care and communicate information to nurses on other unit about client's transfer. Key messages. Written policies and procedures are the backbone of the quality system. Complete quality assurance records make quality management possible. Keeping records facilitates meeting program reporting requirements. Records and reports reveal the essential aspects of service in such logical order so that the new staff may be able to maintain continuity of service to individuals, families and communities. Hope this video is beneficial for you. Thank you.